Hello, everybody. Welcome from lunch. Let's give ourselves a good round of applause. It was a beautiful lunch, wasn't it? You see, I told you people I'll give you freebies. I'm watching, my freebies will come. Chizoba is going to action a 3-group process where we'll have 3 groups. One group will look at the thematic area of adaptation. What does it mean in the FP space? What have we done? What are we adapting to? And I want to give you a expo. Innovation, how have we innovated within the pandemic? I think some of those conversations happened this morning. Have we shown some resilience in the face of the pandemic and other humanitarian setting issues like in the Northeast? What sort of resilience have we shown? We are going to divide ourselves into 3 groups, and each group will have 20 minutes each to talk about these issues, and then report back to plenary. 3 minutes to report back to plenary. So you have to look for your active key points. And after that, we'll now have a plenary conversation to develop our communique. Remember that there were 3 presentations, one from Fatima, the second from Dr. Dogu, and then the third one was from the keynote speaker. And they're all the conversations. So remember, that should be at the back of your mind as you're discussing. So can we do that? Chizoba, thank you.
Oh. I think we can all come back for plenary, please. Can we wrap up at the group level? Thank you very much. Maybe we need an energizer before we start. Anybody can help us? I know my colleague from the, yes, from the National Women Development Center. Can we have an energizer? We had lunch and then came back into this very intellectual thing we're doing. So let's have something so that we can strengthen. Use your pen. Can we please all rise, be upstanding, everyone? Okay. All right. Okay, can we just stretch forward? Stretch as fast as, oh my God, even for me. Let's see you stretch. Take it down. Take it down. Gradually. And bring it up, bring it up, bring it up gradually. Can we take it to the right? We know those of you who go to the gym. Let's take it to the left. Can we do that a little faster? Right, left. Right, left. Forward. group will have maximum of 3 minutes and will be very, very strict with time. Maximum of 3 minutes. Just give us the points, the main points. You don't have to give us preambles. We know what the preambles should carry. So go straight to your thematic points and let's carry on. We are very democratic here, so which group wants to go first? Group one? Where's group one?
Which one is group one?
Which one is group one? Yeah. Okay, are
Adaptation.
you ready?
Adaptation.
Adaptation?
I am giving the
Fantastic.
Thank you. Um, Good evening or good afternoon, everybody. Um, I'm the rapporteur for Group One. Our topic is adaptation, and we had 6 or 7 main points. The first one was policy issues. We know that the policy is a statement by a government that is documented to support whatever we want to do. And we looked at the second point, which is service delivery. Service delivery, these are the major or sort of examples of delivery issues we should adopt. We talked about the private sector being a major part of service delivery, and they should be categorized into 3 tiers. Tier 1 should be like people without training. Tier 2, people with a limited amount of health training. And tier 3, we could have pharmacists. I'll explain that later in the adaptation. Uh, Number 3 is logistics management, which is getting the commodities to the right places at the right time in the right condition. Number 4 point is demand issue. This is when the product is available, to know where to find any particular product and its availability. Number 5 is accessibility issue, making sure the person who wants to use the products is able to get it and at the right time. 6 is mitigating issues, what to do to resolve issues or challenges. For instance, if we have security who probably prevents women from getting to anywhere, maybe to have access to family planning. So what do we do about it? How do we enlighten them or encourage them? Number 7, monitoring and evaluation. It has to do with monitoring of the job and also evaluating it. We also talked about under monitoring and evaluation, we have awareness programs and more sensitizations to be created for rural women, especially because there are some places in rural areas where these women don't actually understand what family planning means. So there should be more, sometimes door-to-door awareness programs just to enlighten them. So we talked about how we could adapt these 7 important points. Our policy issues, we could have door-to-door demand generation, so where we could actually have most of these products being delivered on door-to-door basis, so that we make sure we can get these products across to as many people that need them as possible. We talked about another policy for self-care. Normally, we depend on healthcare providers most of the time, like nurses and doctors. But we have seen that with the challenges of COVID, there was a lot of limitation with contact. So now we could try to train people or encourage people to go about self-care. For example, self-injection, um, self-injection and all that, because that's going to help a lot when we are faced with mitigating challenges or unforeseen circumstances that nobody thought about. And telemedicine, that's another area and that's another policy that we should also try to develop, because in advanced countries now, I think like Kenya, most times people can have medications even administered to them on the phone. Sometimes you can hold your phone and then the doctor can be looking at you and having an x-ray of your chest. So we can actually implement policies that can regulate this. Service delivery, at the village level, we should have more healthcare centers. Private sectors, in terms of we can implement door-to-door services like Mary Stopes already does. And then we should have more pharmacies, Because I know during this COVID, some people couldn't visit hospitals, but we could easily run to pharmacies. So if we can have more pharmacies in different areas and different communities, it could help. Number three, logistics management. It should be well financed. If you're able to actually put in more money or resources in transporting these products, it will be able to go a long way. Healthcare personnel should be well monitored so there'll be no diversion of commodities. Because sometimes people that are in charge of distributing these products end up either hoarding it or taking it to the wrong places. So we need some sort of monitoring and evaluation for that. Number four, demand issues. Door-to-door information, commodities, like we said. Then accessibility issues. That telemedicine will go a long way. Everything is going digital now. If we can learn to start administering family planning commodities or products through telemedicine, then we'll see that we'll be able to cover a lot of ground, a lot of women, a lot of places. Mitigating challenges. The issue of transporting women, even in a crisis situation, to more facilities. We have to enlighten the security personnel, enlighten them sometimes, because I see some, even during this COVID, some women were prevented from getting across to their clinics or centers, and we had some casualties or emergencies. So if we could actually train the security and what they're supposed to do, or how to escort them, it would go a long way. Thank you very much.
Thank you very much. I think she ended well, emphasizing on emergency preparedness. Yeah. Group two, are you ready? Yeah. Group two, 10 seconds have gone.
Okay, so thank you very much. I will try and keep this very, very simple. Um, so for group two, we looked at innovations that we could bring into ensuring that our clients still receive sexual and reproductive health services. So under the policy bit, we felt that our policy outdated and
Hello. Because online people are not hearing us.
with what? So the policies, we felt that there is the need to review our current policies and guidelines to remove restrictions that limit women from accessing sexual and reproductive health services. Some of those restrictions, examples of such policies is adopting the task shifting, task sharing policy and domesticating it. And this will go a long way in empowering some other lower cadre to lower cadre providers to deliver quality services. Again, there is also the need to revise some of our protocols. Some of our protocols that are unnecessarily very lengthy will need to be revised, reduced um, to, um, to sizable length that will be able to deliver, that we're able to meet the needs of our clients. There's also the need for a national self-care policy in terms of looking at where the whole new normal is going to, and then trying to adopt strategies that will be able to fit in to the new normal. So the self-care policy is also something that we also felt is very, very important. Under service delivery, quite a number of them. I'll just run through them without any explanation. There is adopting the e-health strategies, where we have telemedicine, mobile health, where we have digital healthcare accessing, telemedicine, digitalized healthcare services, and there's also innovations in service delivery. Talk about the home services system and also delivery of healthcare commodities.
How do you mean on the same time?
We also looked at innovations at using present platforms such as the WhatsApp groups, the SMSs, to be able to put our clients or groups in a platform where we can discuss challenges with healthcare, and then we'll be able to support them in order to deliver their services. Under logistics management, we feel that there is the need to digitalize the current logistics system such that we will be able to be more efficient in our logistics, national logistics systems. And then we also felt that there is the need to bring on board a dashboard that will be able to manage state level, local level, as well as national progresses in logistics and of commodities, so that it's not when it's already out of stock that one knows. So it will improve efficiency. Under demand generation, we felt that there is the need to bring into um, behavioral change, because COVID is all about behavioral change. People need to, there are still places where people don't believe in COVID. Our messaging, our communication should be strategic and should be get into changing the behaviors of the people in our communities, and this will help. So there's a need to review our current approaches of enlightenment of the public such that it's more strategic, addressing COVID and its current concern, and at the same time dispelling misconceptions. There's also the need to establish a national call center, call center strategy where people can know where to call to whenever they have challenges with sexual and reproductive health issues, including gender-based violence and the rest of them. Under monitoring and evaluation, we propose that there is the need to strengthen the current M&E systems to be able to be more efficient in terms of digitalizing it and making it more robust and more easy to use too. And then we should remove some of the analogs and paperwork that constitute a huge obstruction in terms of tracking interventions. So in a nutshell, that's the summary of some of the innovations we felt. Thank you.
Thank you very much. I think there has been a lot of cross-cutting issues talking about adapting and innovating in terms of the new normal that we all have found ourselves in. And technology comes in strongly here. And I like the fact that we need to start change messaging that will accelerate behavioral change. I think both groups have also spoken strongly to this. And I just want to add on that it's as we prepare new messages, we must also be very strategic in using local languages. In countries where there has been a dramatic change in terms of demand and usage of FP and other reproductive health issues, has been areas where people can identify with the languages that are spoken to them. And so it does drive the buy-in of the community, which is very important. Thank you very much, group three. Thank you.
Good afternoon, everyone. So ours was group 3, and we talked on resilience. And we looked at it under the different teams. And the first one was on demand creation. So we felt like one of the things that made FP more resilient was the use of social media to create demand. People got to know that they could still go to facilities and still access healthcare services from social media. We also felt like social media reaches only a certain niche of people. So the use of religious and traditional leaders, a rural community, was also used. And I remember one of the presenters had said that we can't just sit down here in our comfortable places and think that whatever interventions that we are applying would reach people in local communities. So we thought of using traditional and religious leaders. We also heard that the use of community mobilizers and volunteers to reach people in the rural communities as well. We also recognize that traditional media did not phase out. It is still being used and it can be used to create demand. Then for service delivery, one of the things that we heard were that healthcare workers were afraid. However, sorry, it's so uncomfortable. So we found that despite the fact that healthcare and service delivery personnel were scared, they didn't altogether stop delivering services. They kept going to the health facilities and they were still delivering services despite their fears and despite the fact that they didn't have personal protective equipment. We also heard that telemedicine was used. So the person who presented from Maristo told us that telemedicine was used as well for service delivery, and they conducted home service delivery as well. So people were being called, they recruited them online and for them to receive short-term methods. For logistic management, we realized that during the lockdown, there was still unrestricted movement despite the fact that people had to stay at home, there was still unrestricted movement for the movement of health commodities. So people could still travel if they were transporting health commodities. And across health facilities, there was redistribution of FP commodities or commodities from facilities that had more and less clients to those that had a lot of clients and less commodities. For mitigating strategies, so one of the things was, of course, the lockdown was done so that we could mitigate the spread of the virus. We also used technology and social media to create awareness. So if you remember, between April and now, there's been a lot of social media naming and shaming of people who are perpetrators of rape, sexual harassment, and all of that. So we felt like the use of social media, technology, and all to name and shame those who perpetrated gender-based violence, sexual harassment, rapes, and all were on the increase. For monitoring and evaluation, it's almost the same with the other one. We realized that there became a lot of reporting and a lot of documentation of gender-based violence and a lot of sexual predators. So people weren't reporting before, but now people are now reporting and it's being documented. For policy, we found that there was the enforcement of gender-based violence and sexual harassment laws and policies across states. So for instance, in Kaduna State, they put into law that anyone who was a sexual offender and rape would be castrated or punished. So more policies are being put in place to ensure that the rights of women are being looked into. And these were some of the things that we thought in our group came out of resilience. Thank you.
Thank you very much. I probably would like to re-echo the fact that women's rights are human rights, and we should drive that within the context of demand and supply of FP commodities. Across the three groups, there were emphases on logistics. These we need to pay more attention to going forward. And I think this is the demand for women to be able to, at least go to where the facility is and be served what they need. We have spoken to social media. There are diverse thoughts on the use of the social media. I know that we can use it to accelerate demand, improved access, and getting community to own whatever we have. So there's need for us to also speak to that during these 5 days where the lens of, I pray, the Nigerians will be on this conference. And most importantly, we are looking at the medical staff themselves. They should be protected for them to be able to deliver service. So we're asking for PPE to be available and all wrapped into emergency preparedness, because even in countries that are so developed, they also at a time during the lockdown, the COVID, had problem with supplies of PPE. So let's look in country. Can we start to ask that some of our manufacturers should start manufacturing in country so that they are available when we need them. I think that's the way to go. Even when we are talking to vaccines and the rest of it, we must start looking inwards to see that we can have them on a sustainable level. And we also spoke to religious and traditional rulers. Very important. Very, very important. It worked for polio because until, of course, until when the religious and traditional rulers came on, there were still doubts about whether to present children for the polio vaccine, in spite of all that we've said. But most importantly, what we are saying here and what affects each every one of us and is asking us to do our own bit is the fact that we must continue to create awareness, because there's a whole lot of conspiracy theory when you speak to family planning. Oh, they don't want us to have enough people to be able to, do so. It is not that. I think the theme says it all. It is about having quality life for the mother and the child, and ensuring that childbearing is spaced out in such a way that these days you don't even cut your cloth you don't according to your size, according to the availability of material that you have. So some materials you can only make a skirt from them. You better you better use that. So the reality of the times, yes. The reality of the times speaks to what we are doing here today. And as women, it's knocking on our doors and calling for action that we need from the wonderful progressive women here. Everybody has a role to play, that together we can get there. And then, thank God for technology. But when we are speaking to technology, particularly using the mobile phones, we must also be thinking seriously of what I alluded to earlier on, that is sending messages in local languages and making them very simple so that people can adapt and see themselves in that message. That I'm sure will change the dynamics of where we are. So that next year, by the special grace of God, when we come back, we'll be reviewing on successes and not still be talking about the gaps and the pitfalls that we still have to cope with. I guess I've been able to summarize in terms of the highlights that each of the group. I want to say a very big thank you, and you deserve a big round of applause for yourselves. Um, I'm sure you have made the job a lot easier for the great minds that are putting together the communique. But more than anything else, I think we've been all energized to know that, to understand the roles and responsibilities that each one and us together can play. So we'll just give the communicate people, how many more minutes, please? Communicate. Okay, I'm sure we would fast track it. But before then, can we just do a little networking is important. Adopt a sister, adopt a friend, adopt something from any of the groups. So let's just sit together. I have already adopted the Progressive Sisters. So I have an open ticket for you to come on my show, Bridges, yes. So, and I look forward to that. And I have also spread my tentacles to ensure that Lafia works. It has to work. It has to work. So, so I would send the microphone to you and ask what you have adopted, what you're going home with from this meeting. And for all the he's and she's, the men who have been very strong, they have been with us from the onset to now. And in fact, they had worked throughout the night to be with us here. Can we please give it together and appreciate them? And can the men please be upstanding? Dr. Chika, don't call me unless I say so. Yeah, no, I don't know. Where's your skirt? We're actually going to have. Thank you. I think this man deserves a very loud round of applause. Yes. Well, thank you very much. We as mothers, please be seated. We as mothers, as sisters, aunties, daughters are very grateful for this meeting. Uh, um, we're setting an agenda, I'm sure, that will dictate the tone of this year's conference. And I do hope that you will endeavor to attend from tomorrow after today. You can also go virtual. And for participants out there, thank you very much for staying on. I know that today in Abuja, for example, about 6 important meetings are running concurrently. And for those of you that have stayed through and also online, thank you so very much. We all have a role to play, ensuring that family planning is engendered in national development, and not just in terms of name, not just in terms of policy, but in the actualities of what happens in the health sector. We need it, and we can grow with it and grow better with it. So we will network now. Adopt a sister, adopt a brother, by the way. And let's go. And I'm sure that let's just stretch around and see ourselves in the next 10 minutes. We will have the communique come on. Thank you very much.